Welcome to the New Mom Talk podcast, your go-to podcast for evidence-based answers to your burning questions about parenting. Join us as we dive into commonly Googled topics and hear from experts and real moms. Let's navigate parenthood together, one question at a time. Hi, everyone. So today we're going to talk a little bit about how to support your little one if they have an acute or chronic illness. So we're going to dive in. We're going to talk about what both of these mean. We're going to talk about what it can look like and find some ways to get support. So with that, today we have Alyssa with us.
Thank you, Mariella. I'm Alyssa Pettingill, and I have a private practice here in San Diego where I serve children and families in San Diego County, providing in-home services and helping families navigate different medical challenges and emotionally stressful events. So this could be anything from an acute or chronic illness, like we're going to be speaking about today, but also other things such as like separation from a caregiver, maybe that's due to illness or divorce, but also life-threatening food allergies, teaching your kids how to swallow pills, and even helping kids understand grief and loss. So I provide in-home services to kids of all ages and also provide a lot of support to parents.
Well, let's start with the basics. I like to start with the basics just to make sure everybody knows and understands some of the words that we're going to be using. So, what is an acute or chronic illness, and what can this be in babies or infants?
Yes, absolutely. So first, to kind of share a little bit about my role as a child life specialist, and before we dive into what an acute or chronic illness really looks like, is as a child life specialist, most of us work in the pediatric hospital world, whether it's in a specialty clinic or in a hospital like Rady Children's or even CHLA, Children's Hospital of Orange County. We help kids better understand their bodies. We help parents learn how to advocate for their kids because we know the medical world is complicated and there's so many crazy medical terms that are being thrown around. And we're helping support these families. We're helping educate them. We're helping prepare them so that when they're in this unfamiliar environment, they're feeling a little bit more at ease. So when it comes to acute or chronic illnesses seen in kids, especially in that 0 to 3 age group, we're looking at maybe RSV, which is a virus often seen in kids 2 and under. They're having maybe coughing, sneezing, runny nose, wheezing. So that could require a hospital stay. We also see asthma in really young kiddos, and even some of the more serious chronic conditions like renal disease or leukemia or cardiac related conditions. And there's so many related to that. I don't know if maybe there's moms out there that have had kids that were babies that were preemies, and there's some other medical conditions that are related to that. Failure to thrive is a really common one. If your child's not getting enough calories, maybe that's due to like low breast milk supply, but maybe it's also related to another underlying medical condition. There's so many different medical conditions out there, but that's just naming a few that affect this particular age group that could require maybe your child has a specialist that they see, or they have to go in for different procedures, routine blood work. All of those things are really tough on young kids and could be potentially traumatic.
I feel like just a normal pediatric visit, wellness check can be, right? Especially if you are getting a vaccine and seeing them cry, it's hard. So I can only imagine how much harder something like this is, especially if you're going in a lot more often and you're not sure what's going on or you don't have answers, but there's baby isn't or toddler isn't doing well.
Yeah,
Mm.
and it's like when they're so little too, they're already so vulnerable, and there's other things going on developmentally for these kids. You know, they have that separation anxiety, and then they're going through that, but then you're burritoing them up like in a towel or a blanket, and then they're having to be they're laid down to get these shots or get these different treatments. And it's really tough on them. And sometimes we think, oh, they're too young to remember, but that's not always the case because you'll hear it when you go home, right? They'll be like, "Mommy, remember this?" Or you'll see it in their play often. They'll be playing out these experiences.
Yeah, it's interesting that you say that. Yeah, because it's a big thing of like, oh, they won't remember, but they maybe they won't remember later on. I don't know, but my son just turned 2 and he remembers. He will retell stories of something that happened earlier in the week. I don't know if he's going to remember when he's 7 or 8, but he does right now.
Yeah, totally. And maybe something that happened at the hospital, but then maybe they're in a similar situation where maybe they have to lay down for something else. Like I often see kids really struggle for their first dentist visit because they had a really tough time at the doctor's one time for their wellness visit. So they feel that same vulnerability. And in a sense, it's kind of initiating that fight flight response that happens in our amygdala when we're like overstimulated, we're anxious, we're nervous, we don't know what's going to happen.
It's, yeah, interesting that you say that because my son has never had any issues whenever we go to our pediatric wellness check, dental visits. But he did have to go to the ER for a broken collarbone. And that was the first time where it was like a scary scenario for him. And then we followed up with this pediatrician, which again, never had issues. And it was just like this kind of like, oh my God, it's another doctor coming, checking on me. This is scary. And started to cry and react in the same manner that he did in the ER. It's like, oh my
Mm,
gosh, that's, yeah, clearly he was traumatized just from being in that space, the energy of an ER setting. It's not a calm setting. Everyone is a little bit nervous.
absolutely. I don't know if you're familiar with the term white coat syndrome, but it's something that's so evident among kids and adults where we see that doctor's white coat and we're like, our blood pressure just immediately rises. Like we're like, okay, what's going to happen? And kids feel that too. So even it was so bad during the pandemic because you had that unfamiliarity with that person, but then they also had a mask all over their face. So you're like, what are they gonna do?
Yeah, it's not like a pleasant smile. It's all, yeah, you're covered up.
Yeah, absolutely. And there's something about it that makes kids and parent and adults too just a little bit anxious. Unfortunately, what your son was experiencing is so normal, so normal.
Hopefully, we'll be okay once we're done with the broken collarbone.
Yeah, well, and that brings up just the importance of medical play, which I think is great for the young age groups. And you could even use it for kids. It's up to 10, 12 years old. It's this concept of using either pretend medical equipment, like those cute little Fisher Price doctor kits, or actually even getting your hands on some real medical equipment. Maybe it's like the syringes at the pediatrician office or the rubber bands they use to do an IV start or get blood, Band-Aids, help bringing those to your child's play area at home, which is their safest space, and allowing them to play out maybe what they were experiencing in the ED or at the pediatrician office and encouraging them to play doctor with those stuffed animals and see what comes up because they may have a lot of feelings they want to share with you, or they may have some misconceptions that you need to address, but we know play is a child's work. So it's really important to be able to allow them that opportunity to play through those tough experiences that they've had.
Very good point.
Yeah.
So let's talk a little bit about what can an acute or chronic illness look like in little ones.
But I would say similar to like what we were discussing with RSV, like those are the cold-like symptoms. But when we're talking about things like leukemia, of course, those are the kinds of things that you have to, they can be a lot of different things, right? They could be looking really lethargic and tired, and maybe the color in their face, they look a little pale. There's so much that's out there, and I know we use Google a lot, right? And we go down that like spin of what could it be, but Go with that gut instinct as a parent. If you're feeling like there's something about your child that feels a little bit off, and get to that pediatrician. But when your child is diagnosed with something like an acute or chronic illness, it's really important to have the opportunity to ask those questions to your doctor, ask what the next steps are, write things down. I think a lot of times parents will share with me, it was so overwhelming when we got the diagnosis that like half of the information was just going past my head. But really bringing that notepad in, recording if the doctor's okay with it, so that you can actually look back when you're in a less stressed state to know what was being shared. And then really thinking about how you want to share that information with your child. Because as a child life specialist who has expertise in child development, and as you even mentioned, Mariella, you were saying your son was putting together sentences and getting older, and they are much more intuitive, and they are feeding off your emotions. It's really important for you to be honest with them and educate them in a very like concrete way. So if it is a toddler, maybe you're using stuffed animals to share what you learned about what's going on in their body. And maybe you're saying something like similar to, in using Teddy as the example, maybe Teddy was having a tummy ache. Do you remember when you were having a tummy ache? Well, we went to the doctor's office and we found out that you're constipated, which means like you're not able to poop. And you're going to have to take some medicine in order to poop, just like Teddy's going to have to take some medicine. And then talking about how are we going to take medicine? What's a way that we can do it that's going to be more comfortable? And then including your child in that, because it's amazing if you educate your child and you talk about it in an honest way before trying to like shove a syringe down their mouth to get medicine in them, they're much more compliant. And that's just my always something that I share with families, regardless of your child's age. Honesty and education makes a world of difference when it comes to helping your child take medicine and take care of themselves and help their body when they have something going on with an acute or chronic illness.
I feel like you answered my next question about how parents can support their kids with this.
Introducing the Secret Mom Hacks podcast. Hosted by me, Krista Dykes, this show is for first-time moms who wish to model the best version of themselves for the tiny humans looking up to us. From self-care and worthiness to navigating unique parenting obstacles, expect new weekly episodes that are honest and relatable no matter how old your child is. Subscribe to Secret Mom Hacks wherever you listen to podcasts and leave every episode feeling inspired and hopeful, knowing you are not on this mom journey alone.
Yeah, I kind of did, huh?
So, no, this is great. So then I'll just jump over to the next one unless there's anything else that you think you want to add.
I think education super key, preparation. I think when we talk, right, we can't avoid the pediatrician wellness visits, right? So even if your child is healthy and doing well, I know that needle fear is really common. I see it like, I mean, what kid loves to get shots? It's not common.
Or adults, right?
Yeah, yeah, exactly. Bringing as a parent, being prepared, because there's so much going on in these environments and there's so many new people. Packing that bag with like novelty items is something I really recommend, and like activities to keep them busy. Some pediatricians offices have like the cute coloring books and crayons and stickers, but it only lasts for so long. So for you as parents, you know what your child is into. So bringing some activities for them to do. Maybe it's like a couple of little figurines, maybe it's the reusable sticker books. But then when it comes to like getting a blood draw or getting that shot, bring something new that your child has never seen before. I loved to bring out light spinners. They're super distracting for kids, available on Amazon. It's spinning around. There's so much going on. Your child is focused on that rather than what's going on in their arm or their leg. Bubbles are just magic, and doctors and nurses are super receptive to you bringing in bubbles. And usually they have someone that can blow bubbles while you're holding your child. And yeah, anything novelty. But with that, my final like big tip for parents, especially with the little ones, is advocating for your child when it comes to comfort positioning. So if your child is needing that blood draw or the shot, asking your provider that's doing it, hey, can we not burrito my child? Is there a way we could have him not laying down on the bed? Is there a way I can hold him and have him face me so that I can hug him and so he can be looking this way versus at what you're doing? That way we can reduce his stress and anxiety. And that's not to say you're not telling your child, okay, you're going to feel a little pinch. It's not to say you're avoiding the education piece, but you're also trying to distract them. And distraction has so many benefits. And if your child's focused on something fun, they're going to feel like they're building that, they're becoming more resilient when it comes to these like tougher experiences, right? So asking your providers, hey, can I hold my child? If that's not an option, bear hugging them, can I at least lay down with them? Or maybe you're doing a side comfort hug. There's so many different comfort positioning options. And if you just Google that on YouTube, there's a lot of different child life departments throughout the US that have created awesome videos demonstrating different comfort positions for kids, depending on what's needed.
That's, yeah, great ideas that, because I feel like even if we're getting vaccines, I usually try to figure out ways to comfort my son. So makes sense.
Yeah, and it's something that I think the medical providers like don't think of. They're just kind of like, okay, let's get going, let's get it done as fast as possible. But it really does, when your child is able to be comforted by you and have that close contact, it makes a world of difference.
Yeah, it does.
Yeah,
Just for their security. And,
absolutely.
and what are some resources that are available to both parents and children to get the support that they might need?
Yeah, I mean, honestly, it's one of those things that's so tough because child life specialists work in the hospital primarily, but even here in San Diego, they're not everywhere. There's so many departments, right? And you don't often see us in pediatrician offices. I'm very fortunate to be able to serve families all over San Diego County, but if your child is diagnosed with a chronic illness, advocating or asking your bedside nurse as soon as you find out, or maybe your pediatrician if you find out from them, asking them, if you can get connected with a medical social worker. Is there a social worker that's accessible to you? Oftentimes there is, or maybe it's called a care coordinator in some spaces, but that medical social worker and care coordinator will be able to give you the step-by-step rundown of what's coming up next and what common questions parents are having so that you can feel a little bit more prepared, especially if your child needs like a surgery or something like that. They also will get you connected with like different funds or grants, things like that, all different types of resources to help with the financial burden when it comes to your child having a chronic illness requiring hospitalizations and stuff like that. And just insurance stuff, because we all know that's so tricky.
Fun stuff.
The fun stuff, yes. But there's also a few parent support groups out there for certain things. I don't know a whole lot about the ones available in San Diego. I know Rady has a great one for families impacted by an oncology diagnosis. I think they're working on one for type 1 diabetes, and diabetes can be seen in really young children as well, especially if it's diagnosed in utero. So there's definitely some of those resources out there, but I will say they're few and far between, unfortunately.
Yeah, I feel like it's kind of a pattern. There's more and more that start to come up as far as resources that are available. So hopefully there will be more popping up. But a lot of the times I feel like resources tend to be lacking in anything and like with support for babies and moms right now.
Yeah, and a new area that I'm learning more about and might be more involved in, hopefully, is I'm collaborating more with therapists that are working with moms who are battling depression postpartum. And then I would be working on the kids side, helping kids understand what mommy's going through. Because it's very complicated and it's very easy to misunderstand. Why was mommy like so happy and playing with me and doing all these things before she had baby sister? And now she's sleeping a lot. She's not here. She doesn't seem like she wants to play with me. it's very confusing for kids. So that's like another really area that I'm looking at. Like you said, there's not a lot of resources, but there is a lot of support needed for various things that are going on medically and mentally.
That seems like a great kind of new idea and space to really be able to get kids to understand what's going on and for both the parents and the kids to get the support.
Yeah, totally, totally. Because that's just another, like I mentioned at the beginning, another way of a separation,
Mhm.
separation in a different way, but that emotional connection isn't there. And kids need help understanding why that is so that they're not developing misconceptions that it has something to do with them. Child life can be utilized in a lot of different ways, but it always goes back to child development knowledge and gearing things towards children that's appropriate for their age and developmental stage.
Well, finally, my last question. Do you have any other tips, suggestions, or recommendations for anyone that maybe is having to support their child through this or is looking to see if their child is in this space?
I really think the last thing I'd leave parents with and moms is really just focusing still on maintaining a sense of normalcy for your young child and for your family, because that's something that when an acute or chronic illness comes into play and when it happens, your life can feel very chaotic and it feels very overwhelming. But when you focus on maintaining that routine of, okay, we're still going to have meal times at this time, we're still going to incorporate playtime. Sometimes we look at our child in a different way where we're like, oh, they have this illness, like they're so fragile, they're so vulnerable, we need to, like, we can't take them to the park anymore, we can't do this, or maybe their immune system's compromised. We need to find creative ways to still maintain that normalcy, if that makes sense. We want to make sure that, hey, like just because this has happened, it doesn't define them. Just because maybe I, as a parent, can't feed my child in the way that I want to. Maybe they need like a G tube, which is like a feeding tube to help them get enough calories. I'm still going to try and feed my child in this way, or I'm still going to offer them foods, or I'm going to be in charge of making sure that the nurses know exactly how my child likes their G tube changed, or certain things like that, where you're still maintaining that role as mom, because that gives you like pride and that helps you to feel like you're making a difference, because when your child's diagnosed with something, you feel such a loss of control. So being able to still take on those responsibilities is really important for you as a parent, but then also helping your child understand, like, we're still going to keep things moving. We're going to still keep boundaries going. We're not going to let our child just like run amok and do anything that they want because they have this diagnosis. Your child thrives under structure and routine. So still keeping that despite the medical stuff that's going on as much as you possibly can.
Great. Well, thank you so much. I appreciate you coming on and chatting with us about this topic that's, definitely not fun, but very real in some people's lives. Yeah.
Absolutely. Yeah. Well, thank you, Mariella, for having me. It's a pleasure. If anyone ever needs any support for their child that's struggling to cope with an acute or chronic illness, my website is EmpoweringKidz with a Z instead of an S.com. So thank you again for
Yeah.
having me.
And I will have all of your information linked in the show notes.
Beautiful. Okay.
Thank you.
Thank you.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.